Hi everybody, this is Dr. Ravindran Kumeran from Apollo Firstment Hospitals in Chennai. I am a surgical gastroenterologist, and in this topic what we are going to discuss is what kind of meshes are available in the market. Now what do we mean by mesh? Now hernia is a very common problem in the community and a lot of people have hernia operations worldwide. Now most of these operations would also involve putting in a mesh along with the repair of the hernia so that there is improvement in the tissue strength and therefore you prevent the hernia from recurring, or in other words the hernia from coming back. Now there are a lot of questions about what mesh is best for me, and you have patients often quizzing about this. They start up with simple questions saying, why should I have a mesh? Now the answer is obvious. The mesh is there because inherently our tissues are weak and therefore we have developed a hernia. Now you need to reinforce your tissues so that the hernia doesn't come back. Therefore, a mesh is required. And there are numerous studies worldwide which have proven beyond doubt that people who have mesh incorporated along with their hernia surgeries have better results in terms of failures in the long run compared to people who have not had a mesh put in. Now that answers the question of why a patient needs a mesh. The second question is, what are the various types of meshes available in the market and how is it going to impact us? Now there are broadly two different types of meshes. One are meshes which can be integrated and absorbed in the system. Now there are very limited uses for these kind of meshes. Now you would put them in situations where you cannot have a non-absorbable mesh. In other words, a mesh which stays there for a lifetime. In the presence of infection, you do not want to put in a piece of foreign material. What I mean by foreign material is anything which from the outside which is inserted into a body. For example, when you have a cataract, you have a lens put into your eye. Now that is a foreign material. Now when you put in a foreign material, it is absolutely imperative that it has to be done in the most clean environment. It has to be a sterile environment. Otherwise you would introduce infection into the space where you're doing the operation, and when you put a foreign body along with infection, then the whole thing will get infected. So if there is frank infection present in the patient who has a hernia, then obviously you cannot put in a foreign body which will stay there for life and which will have a festering infection associated with that. So you would put in absorbable meshes. Now these situations are far and few in between. Most patients will have a clean hernia operation, in other words a non-infected area where the hernia operation is done, and they will all require a permanent mesh. Now within the permanent mesh, what are the different types? Now, there are meshes which are of a certain grade, there is certain thickness. Meshes typically resemble mosquito nets. Now, they have small holes in it, so the tissue ingrowth happens and the mesh gets integrated in the system. Now, this integration, when you have a thick mesh, the integration would cause that much more scar tissue for the patient as compared to a thin mesh which will cause lesser degree of scar tissue. Now, if you have a patient who is extremely athletic, who wants to be able to cycle, who wants to do abdominal crunches and so on and so forth, they wouldn't want too much scar tissue forming, for example, in the abdominal wall, which will prevent them from having the flexibility they would otherwise like to have. Now, those kind of patients will benefit from these lightweight meshes which form minimal scar tissue, but yet do the job of preventing a hernia from coming back. Now then, if you are having a laparoscopic repair of any abdominal hernia, sometimes you would put a mesh just exposed to the intestine. In other words, you put in a mesh underneath the muscle and your intestines are below it, which are directly going to be in contact with the mesh. Now, in this scenario, you do not want to put in a normal mesh there. You would want the mesh covered with a certain anti-adhesive barrier so that these intestines do not go and form scar tissue with this mesh. Now what can happen in the long run is the intestines can completely get integrated in this mesh, which forms a lot of medical emergencies in the long run. So you do not want these intestines to get integrated with your mesh. So you put in meshes with these barrier materials so that these scar tissues between the mesh and the bowel does not happen. Now, these are called as dual meshes or barrier meshes. These are broadly the type of meshes which are available in the market. It is for your surgeon to decide which mesh would be most appropriate to be used in your particular situation. Of course, yes, as a patient, you've got the right to ask about what particular type of mesh needs to be placed, and you have a say in the kind of mesh which needs to be placed on you as well. you have to understand that these meshes do get integrated and can never be removed in one piece. And if you have to remove the mesh for whatever reason at a later point, you will have to remove it piecemeal, or you have to cut through the mesh if you want to access that particular area, and that is absolutely fine. That is the whole idea of putting in these meshes into the patients, so that they get integrated and form good, healthy muscles which do not yield to a further hernia recurrence in the long run. Thank you.